Good afternoon, everyone. Thanks for joining us here under this very warm weather. I'm Sevan. Here is Alexandre.
Nice to meet you.
And today we're here to speak about Gratiago. Gratiago is basically a very innovative solution in the field of digital health based on the blockchain. And the idea is that we think we can tokenize our social security, which is not an understatement, and we'll show you how we want to reach that goal. Of course, I will start with a little introduction about our social security. How does it work today? What is our vision for it tomorrow? And then Alexandre will illustrate more further into details our solution and how we adapt it to the moving environment that we know today. So, if the next slides go.
Essaye l'autre.
Perfect. All right, so all of you, whether you are an employee, an employer, a citizen, today you are contributing to the social security. This is a safety net in case tomorrow you are injured, sick, tomorrow if you have any disability, or later on if you actually go and take your pension. This is what social security is. At the end of the day, it's a solidarity that we put in place. Solidarity between young people and older people, between employed and unemployed. And it is a solidarity that is now obligatory. It's mandatory. The state made it mandatory for you all to contribute to it. But it has not always been the case. So if we actually start, let's say, a little history about our social security, and it's actually the case for most of the European countries nowadays, it all started in the 19th century. Basically, when mid of the 19th century, the first workers that were actually experiencing very hard working conditions started voluntarily to contribute to a social pot that will help them in case of a negative events in their life. What happened after that is that there were very big economic crises that led to health crisis. Some of these crises led to starvation in some cases, and the death rate really went high. And the state actually realized that it's not enough to have people that contribute voluntarily, it should be mandatory. So that's actually the essence of our social pact here in Belgium, 1944, where the state made it mandatory for companies mostly, but also employees, to contribute to the social security. What happened between 45 and today is that we've seen a tremendous increase of the cost of this social security. And to basically fill in the gap, the state started to intervene more and more and to co-fund the social security. So basically, the aging population, the fact that the population was growing as well, the fact that we more and more protected the people that were unemployed, really boomed and really created expenditures that just the companies and the employees couldn't cover anymore. So that's really what Social Security 1.0 is. That's today 75 billion a year in Belgium, and that represents 50% of the state's total expenditures every year. And now the state actually accounts for about 40% of the contribution, so besides companies and you employees and workers. So what is the problem with it? So today, the expenditures are still rising, but we can't actually ask anymore the state to contribute because the state is indebted as never before, 105% of the GDP today in Belgium. The companies cannot contribute more without harming their competitiveness. And third of all, the workers cannot contribute more. We are in the country where workers are the most taxed, 53% for an average wage. So basically, it only leaves us one way. It's either we go on the American model and we start reducing the universality of our social security, so not everyone can be actually protected, or we also decrease the coverage. Not every sickness, not every health issue will be covered anymore. We believe it's not an issue in Europe, because if we go that way, it will provoke and create a lot of social conflicts. The second way we see is a mutation, and that's the one we are contributing to with Gratiago. So let me finish by sketching a little bit this mutation that we see and the vision for our social security of tomorrow. Let me take the analogy of the previous speakers about the climate. 15 years ago, there was not a lot of education about the climate. We didn't really know how individually we could act to actually preserve our climate for the future. But for the last 15 years, there was this huge machinery of people educating us about what we call eco-responsible gestures. Basically, you leave your house, you turn off your heater, and you know it's good for you, economically wise, but also for the planet. The idea is that we need to start doing the same thing for our social security, because our social security, as the climate, is a common good. It's a right, but it is not something that we ought to. We need to be responsible with it. And that's really the center, the cornerstone aspect of the project here. But in order to do that, we need to encourage people to actually apply these good gestures when it comes to the health care system. So what are the good gestures? Basically, tomorrow, if you eat more healthier, if you do more physical exercise, if you start taking more regularly your medicine, as Alexandre will explain right after, you are actually creating savings for our social security. This is now proved because you're reducing your probability to be hospitalized. And so at the end of the day, you create a lot of cost savings. And these cost savings can be tokenized. And if we allow it to be tokenized, that it can come back partially to the patients, to the citizens that are being responsible with the way they treat their health. And so this is the virtuous circle that we really see as the social security 2.0, is that you are being more aware that you have a real incentive, that you have a real impact on the social security by being more responsible, and that you are being encouraged in the long run because part of the savings that you allow are coming back to you. And this is all being possible because of the state-of-the-art technology, AI, blockchain, that allows for much more efficiency in the system, but also the tokenization that I just mentioned. So let me give the floor to Alex now to illustrate really in detail what we do with Gratiago.
So thank you, Sevan, for this good elevation. So we were asking how we can build this 2.0 social security system. And the first door we wanted to open, because everything starts with a door, is the non-adherence problem. The fact that people in Europe and in Belgium are not taking the treatment correctly. Did you know that more than 50% of people with chronic disease in Belgium and in Europe are not adherent? It's huge. And this also creates huge costs for a social security system. In Belgium, we speak about 3.2 billion euro per year, only for direct costs. And in Europe, we speak about 125 billions. So how can we make all those savings and save this security social model? So we check a bit what was the causes of non-adherence. The first causes is simple, is that patient forgets. And we can understand it. The second one is that people are afraid of side effects. And this is also because there is a huge gap between the quantity of positive information you receive about your treatment when you see a doctor every year, 15 minutes, don't have a bit of time, don't have a lot of time, and the quantity, the huge quantity of negative information, which is abundant, that you receive. You go on Doctissimo, you think you have 3 cancers, you check the list of side effects with your medicine, it's kilometric, and this creates what we call the nocebo effect. And this nocebo effect results in, of course, doubts, fear of side effects, and really low treatment efficiency. The third thing is that people are lacking of motivation, and also we can understand if you have a chronic disease, you have treatment for life, for years, and it's normal that sometimes you can lose motivation. So that's why we've decided to create Gratiago, an e-coaching solution that helps the patient in those 3 things. So we developed 3 modules. The first one is the pill reminder that simply gently invite the patient to take his pill. The second one is the Gratiago methods, so the core of our application, where we bring back positive information at the moment of treatment intake, through visualization, information, and this is really important. At the moment of treatment intake is where everything happens. Whether you can take your pill as something that you don't like, as a poison, or you can take your pill as something that is good for you. And this is also related to what Sevan just said. I think in our society today, sometimes we forget that we have luck to have affordable access to healthcare and easy access to treatment in our countries. And the Gratiago contributes to giving back this information. The third module is the encouragement to keep also the patient motivated, but also because in our society, too often, we sanction negative behavior. You don't put your trash out, you receive a fine. You do good behavior, you're not specially encouraged. And it's a pity, we think, at Gratiago, because negative and sanction paralyze people, whereas encouragement dynamize good behavior. We think with Gratiago we can stimulate the best of people and make patients that are today too much only consumer patients into more active patients responsible of their health. So let's take the case to understand how does it work. The case of Anne. So Anne, she's 60 years old. She's adherent 50% of her treatment, so she takes 50% of her treatment. And so unfortunately, Anne has 18% chances of being hospitalized in the next 5 years. These are the cost, of course. So if Anne now decides to take and to use Gratiago, she will reduce this because she will increase to 75% of adherence. So she will reduce the chance of being hospitalized to 12% and make saving for the insurance 200 euro per year and make saving for the social security 600 euro per year. So we see it's a win-win model where the insurance is benefiting for Anne's behavior. Anne is benefiting because she will, of course, have a reduction on her insurance cost. She will have a better healthcare, and she will also have access to different rewards and encouragements in a network of positive partners. Like, for example, she will receive a basket of healthy food at Casidomi, one of our partners. So we see it's a positive ecosystem. But what will change? In phase 2, we're going into the tokenization. And this tokenization will have 3 advantages. The first one is that Anne will now receive not points, but token, and she can exchange those tokens in, of course, the real economy. She can have access to goods and services, but she can also exchange a token against other tokens. She will also be part of a community of engaged patients. She will have the opportunity to vote, to take part into the governance of Gratiago. So, for example, she can decide and have a vote on which disease we should put on our platform. And third thing is the pricing and the value of the token. So we'll see that with the rise and the rising success of Gratiago, Anne's token will also increase in value. And that's fair, because Anne is creating value for her, for the society, and this value is coming back with this tokenization. In phase 3, we're going even further in the metaverse, because we think the future of healthcare is also in the metaverse. So Anne will not drive these 60 kilometers per day to go to the hospital and have a consultation. She will directly have a consultation on the metaverse. She will also receive tokens still and use those tokens to receive patient education modules in the Gratiago Institute that we will create. Patient education is super important for us, and that's why we already bought a land in the metaverse. It's already done. So we really believe in this future of healthcare, in this future of our social security. And if you want to share this marvelous adventure with us, how you can get involved. 2 options. The first one is financially. So we are currently finalizing a fundraising in July, and so we still have some opportunities if you're interested. And the secondly is partnership. So we're always looking for partners to think and collaborate who are sharing the same values as us and our desire to safeguard our precious social security system. So feel free to contact us, and thank you for your attention.
Thank you very much.